Hey guys, welcome to this video. Thank you so much for tuning in. My name is Brendan and today we're going to be talking about exercises that you should be doing for chronic pelvic pain syndrome or with chronic pelvic pain syndrome. This is a question I get sent a lot. I get a lot of questions through Instagram. Thank you for everyone who reaches out on there. I get a lot of messages in the comment section of my videos for chronic pelvic pain. Brendan, what exercises should you be doing with chronic pelvic pain? How can I train? How can I be healthy? How can I do the things that I want to do? I'm going to answer that question for you today, but the first step in this process is to ask yourself the question in the morning. Maybe get a journal together or a piece of paper, or maybe make a note on your phone. Whatever it is, just have a piece of paper there and just say, hey, how do I feel on a scale of 1 to 10 in terms of my pain level today? As I stand, as I get out of bed, how am I feeling? Am I a 10 out of 10, really bad pain, or am I like a 1 out of 10? That is a good gauge as to how much stress you need to be putting on your body that particular day. Exercise is a stressor, and we'll come on to that in just a second. But what you've got to remember is that your autonomic nervous system is a system that helps to govern things like your blood pressure, things like how your pelvic floor responds. And what you've got to remember about your diaphragm and your pelvic floor and your rib cage is that they all exist in this realm up here, which is sort of your midsection, as it were, and that's a pressure system. It's like a balloon. If I push down on my rib cage, pressure will shift down into my pelvis and down into my diaphragm. Equally, if I pull my stomach in really tight, my rib cage will lift and the pressure system changes. So if you've got chronic pelvic pain syndrome, that pressure system can be highly volatile. And if you put too much pressure on a particular part, you can exacerbate your symptoms. And if you have too little pressure, you can end up creating more of a spasm in the pelvic floor. So you've got to be mindful that your pain level and your pain threshold for that day will determine how much stress you can put on that pressure system. So what I would highly suggest you do is check out this video by Functional Patterns. I'm a functional patterns practitioner myself, and that is the way that I've helped to eliminate the chronic pelvic pain syndrome and still get my exercises in during the day and still train. It's called a movement elimination protocol, similar to how you would do with a nutritionist if you had stomach problems, or maybe you were having a reaction to certain things but you weren't sure what. The nutritionist would suggest an elimination diet. You take out all the stuff, you see how your body responds, and then you reintroduce things as you go. And that is a really good way of helping yourself through chronic pelvic pain syndrome. We don't want your autonomic nervous system to be stressed. We don't want your whole body to be stressed. And so it's really important to think about that when it comes to your training and your exercise. And we'll talk about things to avoid doing in just a second. For the most part, what I would start with is myofascial release. So I would look to release things like your quadriceps, your IT band, your glutes, and your calf muscles, and then work on some pressurization drills, not breathing techniques, more so pressure drills, how to expand and contract and how to use this section of your body. And if you want more help with that or details on that, just hit the comments down below and I'll give you some resources that you can walk away with there. Now, what we can introduce is what we call LISS, or low intensity steady state cardio. So things like walking would be very good. However, you've got to gauge that on your stress level. If your pain is a 10 out of 10, is it really good for you to go and walk 10 miles? Probably not. But if your pain is like a 1 or a 2 out of 10 and you feel like getting some fresh air and stretching those legs out a little bit, go for a walk. But think about trying to alleviate the stress levels before you start to bring them back up again. Another point that I will raise with this is have a look at the 10-week online course with Functional Patterns. In this 10-week online course, you learn how to address your body's imbalances. And for a large part, if you've been dealing with chronic pelvic pain syndrome for any length of time, your body will have developed compensations and adopted positions which would force you into an awkward place with your body. By spending time on a course like the 10-week online course, it's about understanding how your body responds to stress. And if your body is stressed and you're in a position like this, and then you're trying to do a whole bunch of exercise, you're only going to exacerbate things. So having that checkpoint and saying like, I need to just stop, clear the slate and reinvent how I stand, how I walk, how I move, because that's going to be integral into rebalancing your body and taking away some of the stress. Future Brendan here. I'm editing this video at the moment. I'm just going to talk quickly about confidence and your confidence in your own ability to solve the problem that you might be facing. If you find that you're struggling with confidence and you're not entirely sure that you're going to be accountable to yourself for 10 weeks on a 10-week program, then definitely look at seeking out help from a functional patterns practitioner, because that will give you the accountability and the guidance that you might need to get the ball rolling and help you on your path to being pain-free. Things to avoid. I would avoid doing HIIT exercises, HIIT training, things like that. I would avoid doing exercises that require quite big pressure changes, so jumping up and down, squats, deadlifts, that sort of thing, at least for the first few months. Maybe something to look at down the line. For the most part, you've got to ask yourself, like, if I've come to this chronic pain for no apparent reason, and I've been doing exercise all my life, and I've been doing stuff without having to think about it, now every time I do something, I'm hurting. It stands to reason that you might need to change up what you're doing with your body so that you can correct some of the imbalances that you might have in your body itself. The last part of this is the holistic approach to it. I understand that movement and exercise go a long way in helping you feel better, which goes a long way in helping you reduce your stress and your stress response. It helps me massively as well. So the main thing that I would say is go back to that journal, go back to that morning question. How do I feel on a scale of 1 to 10? Do I feel like I can take on some increased load today and do something a little bit more active? Or do I need to spend a little bit more time thinking my way through this process and understanding my body a little bit more and learning about the different techniques there are for coping with stress and stress management? That, in a nutshell, hopefully sums up what exercises you should be doing. Just to recap, focus on myofascial release. Don't get too carried away with stretching, because stretching long term won't be the answer. Introduce some low intensity exercise that you can focus on and that you can do, and gauge how you feel every single day on that scale of 1 to 10 and nudge your way to better health. And if you've got any questions, or if you feel like you have to ask me something directly in private, just reach out to me on Instagram or hit the comment section down below. I hope that's been helpful for you today, guys. I will catch you in the next video. Have a great day, stay strong, and keep moving.